Hi, I'm Wendy. Welcome to Baby on Board. In this video, we will cover the most common early causes of breast and nipple pain. The most common cause of early nipple pain is poor positioning. Having said that, most women experience some soreness in the first few weeks, as babies feed between 8 to 12 times a day initially for around an hour. Getting the attachment right is crucial to feeding being less painful. Bring the baby to your breast rather than the breast to the baby, and make sure that your nipple is spherical when you take the baby off. Always break the latch by placing your clean little finger in the side of baby's mouth to break the suction. Most mums do feel sore in the first few weeks. Your nipple will not have had up to 10 hours of suckling before. Current advice is to use some breast milk to rub into the nipple after a feed. If your nipples are bleeding or very grazed, a lanolin cream can stop your breast pads sticking to your nipples and having to be pulled off, causing more damage. Other common solutions to nipple pain are cold tea compresses, lanolin, vitamin A, hydrogel pads, moist dressings, or no treatment except breast milk. Some mums have said that the hydrogel pads are soothing. In 2007, a study of the use of peppermint water, which is used to prevent nipple cracks in the northwest of Iran, found that peppermint preparations were associated with fewer cracks, possibly because of the antiseptic properties of the peppermint. Sometimes when mum has large nipples and baby has a small mouth, no matter how hard you try, it is difficult for the baby to get enough breast into the mouth. This will resolve as baby gets bigger. So the take-home message is hang in there, as it will resolve. Usually most people have less pain by around 2 weeks. It eventually resolves and breastfeeding becomes pain-free and easy. If it is still painful by 2 weeks, there can be other causes. You may need to seek further advice. Breastfeeds get shorter and less frequent as the baby grows. By 3 months, a feed may only last for 10 minutes, so the whole process gets easier. If your nipples crack or are bleeding, you may have to rest and express until they have healed. You can hire a double pump to save time, and the electric ones are most efficient. The nipples have a very good blood supply and usually heal within 72 hours, and then you can attach baby again. You need to keep expressing every 3 to 4 hours to maintain your supply. Nipple shields can be helpful if your nipples are painful. The downside to using them are that they will reduce your supply over time, as one of the things that stimulates milk supply is the skin-to-skin contact of your baby's mouth against your nipple. The breast does not drain as well when you use a shield, and this can predispose you to mastitis or inflammation of the breast. Sometimes using nipple shields causes the baby to not want to go back on the breast, but short term they can be very helpful. They have been around for a long time, and they were made of bone and silver in the Middle Ages. Other complications that can happen with cracked nipples are that they can get infected. If this is happening, see your doctor for an antibiotic cream. Another condition which means that baby cannot attach properly and feeding remains painful after 4 weeks is tongue tie. When babies are developing, the tongue is fused to the floor of the mouth. As the baby develops, the tongue is freed and only the tie remains. Baby tongue tie affects around 5% of babies and is more common in boys. Studies have shown that having a tongue tie will affect successful feeding in some babies. Tongue tie is when the tongue is not sufficiently long to feed properly, and there is usually poor weight gain, prolonged feedings, an unsettled baby, and mum has sore nipples and unrelenting pain with feeding after 4 weeks. The decision to cut the tongue tie is made if baby cannot latch well and or has poor weight gain, and an examination of the baby's tongue shows that the tongue does not protrude past the gum line. When baby cries, the tongue is heart-shaped. You will need to have your baby assessed by a dentist or paediatrician. Numerous studies have shown that cutting the tongue tie reduces nipple pain and improves the attachment. If surgical snipping is done before 4 months, it can be done as an outpatient procedure with no anaesthetic, and a post-procedure breastfeed stops any bleeding and provides pain relief. If your baby only has mild tongue tie, then the tongue will naturally grow and the problem will resolve. I wish you every success with your feeding becoming pain-free and hope that this information will help you. If you found any of this information useful, please like and subscribe. If you click or tap the video on the top left-hand corner of the screen, it will take you to another related video. Please visit my YouTube channel, Baby on Board with Nurse Wendy. See you next time.